People, a lot of, at least last 20 years, the conventional surgeons used to say, after 10 years, you have to go for exchange. But a silicone is an inert material. So once it goes inside the body forms a shell around it. It's a natural protection of the body, which forms a thin layer around the implant and protects it from the body. So even if it is inside the body, it is actually not in communication with the body. Silicone being an inert material, it has no lifetime limit or lifespan. It will be there for a rest of life. Only reason people actually exchange implants is when they don't wear a proper support, there will be some amount of sagging. So that is the only indication, or if there is any other complications like a capsular contracture, any hardness. Otherwise, you don't necessary to change implants after 10 years, which was a more of myth. And the fact is, no, they can continue the implant for the rest of life. You don't need a compulsory exchange of implants. Like a lot of people say, 10 years or 12 years. People used to say 15 years, but actually it's not required.